you who don't know me, my name is Kathleen St. Caliento, and I have the honor of serving as Cara Collective's president and CEO. I'm so excited to be with you today because, as some of you may know, September is National Workforce Development Month, as well as National Hunger Action Month. And I don't have to tell many of you who are listening in today that the two go absolutely hand in hand. Both economic mobility and food security are salient issues, I know, to me for our work at Cara Collective, because we know members of our community face barriers beyond unemployment, like having enough food for themselves and for their families. We also know that in today's economy, food security isn't guaranteed after someone gets a job. And in fact, from June 2021 to June 2022, this past June, food prices for groceries have actually risen 12.2%, which is the largest 12-month increase since April of 1979. You heard that correctly. And that was all according to an analysis done by the Center on Budget and Policy Priorities. More than 38% of our adults in Illinois are having difficulty paying for usual household expenses. That's also according to a census survey, which means that even though people are employed, they are struggling to afford to put food on the table. That is why today we are joining forces with our guest and my dear friend, Kellie O'Connell, who's the CEO of Nourishing Hope, to talk about these alarming trends and how both Nourishing Hope and Cara Collective are working to remove barriers to food and job access. So Kellie, I'm going to kick it over to you. For those in our community who aren't as familiar with you or with Nourishing Hope's work, tell us a little bit about your organization.
Awesome. Thanks, Kathleen. I'm so excited to be here and so inspired by the work Cara Collective is doing to pull people together to have these intersectional conversations about the work in our city. So a little bit about us, Nourishing Hope. So we are formerly known as Lakeview Pantry. We've only been Nourishing Hope since about May. We were founded in 1970, and today we're a dynamic social service organization that provides free food, mental health counseling, and social services like job and housing assistance to any Chicagoan in need. We operate two pantries, the bustling Sheridan Market in Lakeview and El Mercadito in Humboldt Park, and that's in partnership with La Casa Norte. We also have an online market program, which allows people to order food online for pickup, and a home delivery program for older adults and people with disabilities. As you noted in your opening, we're really seeing an increased need in the community because of soaring food prices, gas prices, the impact of inflation, right? Overall, visits to our food programs are up about 40% compared to the same time last year. So as I mentioned at the top, in May, we rebranded to Nourishing Hope because our legacy name, Lakeview Pantry, was increasingly limited. We're much more than a food pantry at this point, and we serve many more neighborhoods across the city, not just the north side. We also, in May, opened a new centrally located headquarters and warehouse space online market fulfillment center that is centrally located to help us grow partnerships on the south and west sides. And then finally, we also provide free mental health counseling and social services like case management, emergency grants program, benefits access, and housing assistance.
Well, and I love that, Kellie, because so many of these challenges and issues that many of our participants face are so intertwined, right? Although Cara Collective is a workforce development organization, we are also so much more than about just getting a job, which is why we focus on things, as you mentioned, like social emotional training and providing resources that move well beyond employment. So I'm curious how Nourishing Hope decided to go beyond being just a food pantry to offering things like mental health services and other life-changing resources that ultimately serve the whole person.
Yeah. Well, I mean, like you with workforce, we know food fixes some things, but it doesn't fix everything. So this has been an evolution that's been in the works for years. It comes from a recognition that the challenges that folks face are often complex and interwoven, and it's not just about food. We provide social services, like I mentioned, job, utility, and housing assistance, and emergency grants program for people that just need a little bit of a leg up to get on to the next thing, to help stabilize lives and build for their future. We also provide free mental health counseling, and there's been a growing awareness of mental health needs, which are linked to food insecurity. We started that program about 5 years ago because we were referring people out and there was just no capacity. The wait lists were too long. And so at Nourishing Hope, we really try at this point now to serve the needs of the whole person to address what's going on underneath the hunger.
Oh, absolutely. And I love this focus on serving the whole person. And I couldn't agree with you more. And just to underscore this rise and maybe even awareness in need for the mental health supports of the population that we serve, but especially because we know that everyone comes from a different starting place, right? For us at Cara Collective, when it comes to finding gainful employment, many of our participants face barriers, some of which we've already named, that make getting a job even harder. 25% of our participants this year have less than a 12th grade education. More than 60% have a conviction history. So many factors that play a role in economic stability. And to that end, so many things that prevent someone from attaining it, like the lack of investment in communities. And so great to hear some of the work that you're doing even on the South and West side, but also education systems, employers' inability to see beyond a person's background, limited transportation, high pressure family obligations, the list goes on, right? I want to kind of kick it over to our audience and maybe get some chat in the comments going, but what are some of the barriers that you're seeing that prevent so many Chicagoans from attaining economic stability? Would love to see some of your responses in our comments section. And while they're doing that, Kellie, tell us a little bit more about some of the barriers that you're seeing that specifically make it difficult for many Chicagoans to access food.
Mm-hmm. Yeah, they're similar, right? There are many barriers to accessing healthy food. And we know that in Chicago and really in urban areas across the country, Black and Latinx families are disproportionately affected by food insecurity. In Chicago, communities of color, especially on the south and west sides, have endured generations. I mean, you know this, of inequitable access to food, affordable housing, healthcare because of structural and systemic racism. So part of our story as an organization is really the strategic decision to do more to serve more families in those communities by growing partnerships with trusted organizations and local leaders within that community, and really lifting up those leaders and listening to them and thinking about what they need to bring food to the communities. We serve many working families, particularly immigrant families who were hit hard by the pandemic. Often they're working multiple jobs, may not have the access to the same supports that so many do. We also serve older adults and another group that experiences heightened food insecurity, right? We often are on a fixed income and there's just not enough to stretch throughout the month. We proudly serve anyone in need in a variety of ways to meet people where they are at in the city.
That's really helpful. And talking about where people are at, particularly over the past 2.5 years, I think we can all agree that where people are at has significantly changed, right?
Mm-hmm.
And shifted. And I know that Nourishing Hope has had to grow and evolve in response to the pandemic and all the events that have radically changed our world. You know, I often refer to it as both a viral pandemic and as a racial pandemic, quite honestly. I know we've had to reimagine aspects of our model, and we're also presented with opportunities such as helping employers recruit historically untapped talent. So I'm curious, in what ways do the needs of your communities change, and how did you have to adapt given the last couple of years?
Yeah, well, the biggest adaptation was finding a space big enough to keep volunteers and staff and clients safe while serving the increased need. Thankfully, we found a great partnership with the Chicago Cubs as we distributed food to thousands of people out of Wrigley Field, which frankly was completely surreal, right? Like, you're supposed to see kids in line to see a ball game, not to get food. It was a tough moment in the pandemic. And like many other hunger relief organizations, we had to change the way we served people to help keep everybody safe. That was that was like distinct and historic challenge of the early pandemic. Is the need skyrocketed, but we couldn't continue to serve people as we always had. We adapted, we implemented various safety protocols like everybody did, right? Masking, distancing, and was changing by the hour. It felt like trying to figure out how to navigate it. The hardest thing that we did was we had to halt our choice model because we needed to get people in and out and get them what they needed quickly. And so we went to a pre-packed boxes to reduce the risk of transmission. Thankfully, we've since reintroduced the choice model because that's really important to us. Once vaccines became available, we actually introduced a vaccine requirement for volunteers, and we looked for opportunities to serve more people in a variety of ways, including Wrigley, but also by growing our online market and home delivery programs.
That's incredible, and it's always so incredible to hear about the partners that support us in these times of need,
Mm-hmm.
right? And so it's great to hear that Wrigley Field was such a great partner to you in that. You know, I see so much overlap, as we've talked about from the top of this hour or half hour. I see so much overlap in the why behind both what Nourishing Hope and Cara Collective do. And a key component is that we're both in the business of providing hope. We often say that we're in the business of providing hope, jobs, and opportunity. And you obviously quite literally put hope in your name. Hope can sometimes feel like an abstract concept, right? A squishy concept, not something tangible that folks can really grab onto, but it's so important to the work that we do. How does it factor into the work that you're doing at Nourishing Hope?
Yeah, well, similar to you, we say we provide food for today and hope for tomorrow. So that's been our tagline for a lot of years. And when we rebranded, we considered hundreds of names as you go through that process. But in the end, the idea of nourishing hope is so central to our history, our identity, and our aspirations. It's what we do and it's what we've always done and what we hope to do on a larger scale. You can see it for yourself on any given day at our food distributions. You can observe it in the quality of interactions between staff and volunteers and the people we serve, always with respect and dignity and just a little hope. You can also observe it in our built spaces. In fact, our Sheridan Market looks a little bit like a foxtrot type space. And when we first opened the market 6 years ago, a client going down the line to choose his groceries paused, teared up, and shared that he's usually not welcome in spaces like that, like as nice as this. I mean, that was just a huge, like, just a awakening moment of like not feeling welcome to come inside nice places. And so even the built space is offering just a little bit of dignity and hope. We also help connect people both to food and mental health counseling. And when we do that, we're nourishing hope for a brighter collective future. That hope ripples outward. We've seen so many people and families that we serve join us later as donors and volunteers. In fact, recently, one of our home delivery clients said, when you give good, good comes back. And that really is, we find that to be true every day.
It really is, and I love that when you give good, good comes back. It's all about that karma, right? Those are such beautiful examples. Thank you for sharing those, Kellie, of hope. And something that brings me hope is that we are telling stories and engaging in discussions like the one that we're having today. Most people and more people actually are in fact talking about these issues, and I think that is a shift that I know I've observed. Just more awareness on issues like food security, building a more inclusive economy in order to further the conversation, but also drive action, right? We're seeing the private sector ask for more ways to engage with our work in order to support communities around them. And that brings me so much hope for what's possible. For our audience, what conversations do you think we need to be having in order to continue to raise awareness about the inequities that we see in our city? We've engaged in a few of these conversations, and we want to continue to bring to light the ways that we can work together to take action and solve some salient issues. Let us know in the comments what you'd like to see in terms of conversations that we need to be having to raise awareness. And so, I just mentioned some of the things that bring me hope. What continues to bring you and your team hope as you do this important work?
A few things, really. I think I always have to say my team brings me hope, and the Cara Collective team, and really the whole social impact sector. Folks get up and go to work, even in really scary times like a pandemic, to make sure that we're bringing hope to the city. And then one of the few silver linings of the pandemic for me has really been the increased collaboration and partnership between nonprofits, government, corporate sector to make sure that people have access to what they need and opportunities to engage. Our partnerships with trusted and respected organizations throughout the city, I hope we'll be able to see those continue and grow. That's so important because we can only make meaningful progress toward a more equitable future when we work together. And I'm so excited. We're proud to call Cara Collective a partner and a newer, evolving partner in this work as we look forward to expanding that collaboration in the months and years to come.
That's great, and we're so proud to partner with you and the critical work that Nourishing Hope is doing. I want to just take a minute and call out some of the issues that I've seen folks type into the chat. Healthcare, right? That is such a critical need and a huge focus on screening for and addressing social drivers of health. Thank you, Natalie, for mentioning that piece. That is such a critical piece. But are you hearing, Kellie, drivers in terms of healthcare,
Mhm.
and how that is related to the issue of food insecurity?
Mhm. Yeah, I mean, food is really medicine in a lot of ways for a lot of health challenges that people face, and access to healthy, quality, nutritious food can be a challenge. And so, to that end, we actually have I didn't talk about this before, but a Health and Hope program where we partner with hospitals. They screen for food insecurity, like in the cancer treatment centers and the ER, and then we provide food for folks when they're leaving the hospital. So, like we have a partnership with a hospital that. They were seeing their cancer patients come in, go home, do chemo, radiation, have to go home, fight for their lives with no food in their house to nourish their bodies. And so we really stepped in in that way to be able to provide the food, and then we can connect them to our other services through as they're continuing to battle their.
Absolutely, absolutely, and thank you for that. And I think similarly at Cara Collective, one of the things that we provide in even ensuring that someone is ready to take on full-time employment is we do stability assessments, and one of those is focused on health, because we know that if you're not feeling good and you can't take care of yourself, that the possibility of you being able to concentrate on and show up for a job every day is going to be significantly limited. And
Mhm.
so thinking about not just physical health, but to your point, the additional resources that you're providing around mental health and mental
Mhm.
support is huge.
Mhm.
Are you all have you all developed in-house mental health supports? Are you working with other partners to develop some of those resources to your team? And then how do you assess for the need around that?
Mhm. Yeah, that's a great question. So we have 5 clinicians on staff now. And again, when we started, we always referred people out, but unfortunately, those services diminished over the last several years. The city now is investing heavily in trauma-informed centers of care, and we're grateful to be one of those. So we have a whole mental wellness team that sees clients individually. We do group counseling now, and it's all free. We will see people regardless of their ability to pay. We don't bill insurance. We don't take Medicare, Medicaid right now, and so it's supported through the Chicago Department of Public Health and private philanthropy. And what we have found is that having access to that has changes the trajectory of someone's life sometimes, just like the work that you're doing at Cara, right? Like if you can get in there and talk about some of the things that are going on, it helps you get from wherever you are to where you might want to be.
Absolutely. And I'll just ask one more question around this, just because I think it's so critical as we think about what it means to actually nourish hope in someone. If they can't get
Mhm.
beyond what's possible for themselves, that can be a real barrier. With folks who are facing what might seem to them very acute and tangible issues like access to food, a job, a
Mhm.
house, right? Those are very physical, tangible things that
Mhm.
you can see. How do you help them understand whether or not mental health
Mhm.
resources might be something that
Mhm.
they might also, how's your team thinking about that?
Yeah, so the neat thing about offering mental health at some place like a food pantry is it's somewhere people are already going. A lot of folks, for lots of reasons, are not gonna raise their hand and say, "I need to see a therapist." That can be really scary and sometimes stigmatizing in lots of different
Right.
communities. And so the nice thing about, having it right here is the clinicians, our case managers can sort of be in the mix and just talk about, what's going on, and, "Oh, have you ever thought about having a longer conversation about that?" Right? Like, it destigmatizes it. They know us, they trust us, they can
Right.
see the people, right there. And so it doesn't feel like, hey, I'm opting in to go to a mental health clinic. I'm
Right.
just in the Nourishing Hope.
Absolutely. I love that. Um, Julia raised an interesting question in the chat. I'm sure you are very well aware, Kellie, family structures can look very different, and in
Mhm,
terms of even who is providing care,
mhm,
hope, and food for the family. Julia's question was really about, and her interest was in how children who are responsible for food procurement for their families, or also folks who have different abilities, can access food resources. How do you think about that as part of your programming?
Yeah, we really try to focus different programs for different parts of the population to ensure that everybody has access. So a couple ways. We have a home delivery program, and that really is focused on seniors and disabled folks who can't come and get food themselves. And so we'll deliver groceries right to someone's home. The other option is our online market. And so through partnerships with community organizations and schools. Now we're working with social workers in school to help them order their groceries. We pick and pack the orders on site, but then bring them to the school. So you can just pick it up when you pick up your kid.
That's incredible. That's incredible. And I think, making those additional resources as easy to access as possible, in the ways that you're mentioning, is just so critical. So thank you for sharing that. So we have a few minutes here before we wrap up, but for our viewers out there who are fired up and ready to provide more hope, access to healthy food, jobs, all the things that we need to live our fullest lives, how can they get involved in the work that Nourishing Hope is doing?
Yeah, we, sorry, I didn't turn off my little alarms on my computer. We are honestly in urgent need of more support right now. And I know people are probably a little bit fatigued with hearing about that, right? Because it's been 2.5 years of increased need. But we need more support both from the federal government and the private sector. As I mentioned, visits are up, and we don't see an end in sight right now. Inflation is really wreaking havoc on household budgets as everything is costing more: groceries, gas, goods, and that means our costs are also significantly up too. So we really need more donors and volunteers to join us in the mission. You can go to nourishinghopeshy.org to learn more about the work, or how you can donate, learn more about the work, how you can donate, register to volunteer, and help support a future partnership with Cara.
That's great, and I would encourage folks who are tuning in to do that. Thanks so much, Kellie. A key takeaway for me is that we all have a role to play, especially when more than 16% of Chicago households are food insecure, highest among Black and Latino households at 29 and 24%, respectively. And unemployment in neighborhoods whose residents are predominantly Black and people of color soar as much as 10 to 12 times higher than the low unemployment rates that are currently being reported. For us at Cara Collective, 3 ways that you can get involved in our work right now are one, if your company is looking to deepen its inclusive employment practices, please refer them to our upcoming Inclusion Action Lab, where they can join a cohort of employers to learn how to better source, hire, and advance untapped talent. As we know, stronger and more stable job security leads to better food security as well. Number 2, mark your calendars for our most mission-focused event. It's Tribute to the Stars. Join us on Thursday, October 27th for our breakfast with a side of morning motivations, which is a staple, a Cara tradition. You will be in for a real treat if you've never participated. Individual tickets and sponsorships are available at caracollective.org/tribute. And then finally,
I'm just going to give it a plug, because that is like one of my favorite events in the city. We go to a lot of events, but that one, if you need a little hope in your own life, make sure you go.
That is awesome. I did not pay Kellie to say that, y'all. I did not. That's just somebody who knows the truth and is willing to share it. So come out and join us if you can. And then finally, thanks, Kellie. Last but not least, we always appreciate any support you can give as we work to eradicate poverty. As Kellie mentioned, the work of and the support of our donors, both private and public, is incredible. So visit caracollective.org/donate to learn again more about our work and how you can support philanthropically. Kellie, we're wrapping up a few minutes early here, but I want to thank you so much for joining us and for all the incredible work that Nourishing Hope is doing. All of us at Cara Collective are so excited to deepen our partnership with you in the coming year. And to our viewers, thank you so much for tuning in and for participating in this important conversation over your lunch hour. Make it a great day.
Bye. Thank you.
Of course.